So good afternoon, everyone. I'm Dr. Maria Arquila, pediatric pulmonologist from the Department of Pediatrics. For this afternoon, I'll be presenting vaping, frequently asked questions, what hospital personnel need to know. So why does it matter for us to know what vaping is? So first, we have to define what vape is. So e-cigarette use has surged globally, impacting various patient demographics. And as healthcare professionals, it is important for us to understand the core of vape. It is very crucial for us and our patient to have an accurate patient assessment and history taking. This is also for effective patient education and counseling, and for us to address the health concerns related to vaping, and as a whole, to promote public health. Okay. So the aim of this presentation is to provide clear evidence-based answers to commonly asked questions about vaping for us personals in the hospital and also for our family and for our patients. So what is vaping? The definition of vaping is involvement of inhaling an aerosol produced by an e-cigarette or a similar device. The parts of this are the battery, which powers the device, the heating element, or what we call as atomizer or coil, which heats the e-liquid, and the e-liquid, or we can sometimes call as vape juice, contains nicotine, flavorings, propylene glycol, and vegetable glycerin. Sometimes it can also um, include tetrahydrocannabinol, or the one that is from marijuana. And lastly, the mouthpiece we use for inhalation. So FAQ, or fact number one, is vaping safer than smoking traditional cigarettes? So it's a very common misconception that, as you can see from the picture on the right, we have the cigarettes on the left hand and the vape on the other hand, which sometimes can give us the the misconception that the other one is safer from the other, which is actually very wrong. It is sometimes marketed as a safer alternative. However, safer is not safe. So the reality is vaping may expose users to fewer harmful chemicals than traditional cigarettes. Mas mabango rin siya. However, safer does not mean safe. E-cigarettes still contain harmful substances. So what are the short-term health effects of vaping? Firstly, would be respiratory symptoms. You can observe cough, shortness of breath, wheezing, chest pain. But also, since it contains nicotine, it has cardiovascular effects like increased heart rate and blood pressure. If you've seen patients, or if you've seen people who are constantly vaping, you can notice while talking to them, they actually have gum inflammation, sometimes with dry mouth, and increased risk of cavities. Nicotine poisoning, we've observed this not only in adult population who tend to take sometimes vape juice to kill themselves, but also for children who are exposed to vape in the household. So apparently in the US, there is a study from 2013 to 2017, over 4 years, about 4,000, more than 4,000 pediatric patients actually were admitted at the emergency room due to nicotine poisoning. Hence, it is actually a household hazard. So it can present with nausea, vomiting, dizziness, seizures, especially from accidental ingestion of liquids. Another would be device-related injuries. Another study, which was a systematic review done from 2014 to 2017, documented about 160 patients in the United States who had burns and explosions up to about second degree burn from faulty batteries. And from our local news, we all already seen this events. Now let's move on to what are the long-term health effects of vaping. So vaping, although it can be very benign, for if you can see people are vaping but do not present readily with cough or shortness of breath. However, in the long term, it can present with chronic inflammation, scarring, reduced lung function. So their lung function is, it can be as bad as those with chronic smoking, I mean cigarette smoking. Again, it can present with cardiovascular disease, increased heart attack, stroke, again from nicotine and other chemicals. It has also been noted that adolescents who frequently use vape due to its nicotine content can have altered brain development. And because it has nicotine, there is high potential for addiction. Another term or an effect that we've observed with vape use is what we call gateway effect. So, what is gateway effect? So, apparently, when you tend to use vaping in for the youth, they also are highly likely to eventually use cigarettes. And then, if you've heard what is EVALI, what is EVALI? So, EVALI is e-cigarette or vaping product associated lung injury. This has been initially noted as a lung injury in patients who are working in the popcorn factories, which present with post bronchiolitis obliterans, but also it has been noted in patients who are vaping. It can present, as you can see on the table on the right, as cough, shortness of breath, vomiting, chest pain, use of accessory muscles, tachypnea, tachycardia, aroused, and altered mental status. It is primarily linked to vitamin E acetate, especially in the those who which contain tetrahydrocannabinol vape products. But other chemicals in this vape juices can also contribute. It is important for us as health workers to recognize the symptoms seen in the table on the right. When we see a patient who are presenting with these signs and symptoms with a background of vape use, even if it's just short term, then we should be prompt in diagnosis and treatment, and bringing them for health consult. So we know that nicotine is part or is the primary ingredient in the cigarettes that cigarettes, tobacco cigarettes that historically have been used as smoking. But apparently, this is also the component of vape, which is actually, aside from being addictive, it has a wide spectrum of side effects. So it is, again, leads to physical dependence from addiction and withdrawal symptoms. It is damaging to developing brains, not only to during conception, but also to adolescents and young adults. And again, it is very harmful during pregnancy. So are flavorings in liquids, e-liquids harmful? Yes, so these are just four of the components of the flavorings that are very harmful. So one would be diacetyl, which is linked to popcorn lung or bronchiolitis obliterans. Another would be cinnamaldehyde, or which is also known to be a respiratory irritant. The benzaldehyde, also again a respiratory irritant, and those which are ultrafine particles, which can cause prolonged lung damage. Sorry. So fact number 7, how can hospital personnel identify vaping patient? So do a comprehensive history taking. Make a direct question. So just ask them, do you use e-cigarettes or vape products? And what type of products do you use? And how often? Being non-judgmental. Sometimes when you talk to patients, even especially for adolescents, when you ask them, create a safe space and ask them as a patient and not be judgmental. Um, this can preclude them from telling you the truth and you cannot help them further. Sorry. So physical signs include those associated with nicotine withdrawal symptoms like irritability, anxiety. So mapapansin nyo hanap-hanap na sila lalo na pag wala. Respiratory symptoms like cough, shortness of breath, oral health issues. I've noticed this personally when patients who are chronically vaping, they have some gingival swelling. And then as clinicians, we should accurately document vaping status in the patient's records. Okay. How do we counsel patients about vaping cessation? So first, assess readiness to quit. So ask them, ready na po ba talaga sila mag-quit? Are there motivations that can actually guide you to quit? And then provide clear, concise information. Highlight the health risk specific to the patient. And again, address the common misconception. It is not cigarette smoking versus vape. It should be cigarette smoking and vape versus no smoking at all. Offer support and resources. So one would be behavior counseling, refer to smoking cessation programs. We have this in our hospital. Pharmacotherapy. So try discussing about nicotine replacement therapies like nicotine gum. And then lastly would be to discuss that e-cigarettes are not FDA approved cessation devices. E-cigarettes are not your cessation devices to quit cigarette smoking. Instead, it is actually same as cigarette smoking. Is vaping a good way to quit smoking again? Cigarettes are not FDA approved, so it is better to actually use the NRTs. And then many users actually end up dual using. So once they use vaping, they actually tend to do cigarette smoking. Also discuss concerns about long-term health effects and nicotine addiction. So our recommended approach is to encourage evidence-based FDA-approved cessation methods like your nicotine replacement therapies and behavioral counseling. So how available are these NRTs in the Philippines? So we actually have these patches, gums, lozenges, which can be purchased over the counter. However, it is best that you still consult health professionals to guide you on the dosages. We also have this DOH Quit line, which is actually free 1558, which offers free counseling and support for smokers who actually want to quit. There's also another Facebook account, I'm Ready to Quit, which is in partnership with WHO Philippines, which has a chatbot that can support you and encourage you to quit. So again, it is very important that when you start quitting and you'd like to have access to the NRTs, it is important to check with your healthcare professionals first. And then fact number 10 is secondhand vape harmful. So like the traditional tobacco cigarette smoking, secondhand vape is actually still harmful. It is not harmless. Mabango siya, but it is still harmful. It has ultra-fine particles, heavy metal like nicotine and lead, and volatile organic compounds or your VOCs and nicotine. It irritates lungs, exacerbate asthma, and expose bystanders to nicotine and other toxins. So it is very concerning for children, pregnant women, and individuals who have respiratory conditions to be exposed to secondhand vape. So as a big institution, it is important for us to create policies to support smoke-free and vape-free healthcare settings and public spaces. So in conclusion, again, vaping is not harmless. It is not the safer choice versus tobacco smoking. It carries significant health risk, many of which are still being uncovered. Nicotine addiction is real. So e-cigarette does not spare you from addiction like that of tobacco smoking. It's still very addictive. EVALI is a serious concern. So be vigilant. If you know someone who has respiratory symptoms with impending respiratory failure and the background of chronic vape use, then you should consider noting EVALI. Your role as a healthcare professional being in this hospital is very crucial. Educate, counsel, and support patients in making informed decisions about their health. Be non-judgmental when talking to patients so they can trust you and you can help them. Promote evidence-based cessation. Guide patients who are proven methods of quitting, not just over-the-counter NRTs, but also behavioral counseling. Guide them towards our doctors. Thank you. If you have any questions, I'll be glad to answer them.